Your eyes are the windows to your soul. So, doctor, what are the common eye problems we face today?
As in today's digital world, many people are suffering from eye strain due to overexposure to screens. Other than stress-related conditions are also there, like age-related one like cataract, conjunctivitis, glaucoma. These are the common conditions people are affected with. Also, nerve-related diabetic neuropathy. These are the common condition nowadays people are affected with. And in Siddha system, basically based on Agasthyar Nainavidhi and Nagamuni Nainavidhi, the eye diseases are of 96 type.
Okay.
That includes the conditions of conjunctiva, cornea, and eyelids.
So, generally.
Generally. And based on that, Vata, Pitta, and Kapha also related.
Okay. Doctor, what is your opinion?
As Dr. Sreelakshmi have conveyed, the Bharatiya Chikitsa Paddhatis, especially the Siddha, Ayurveda, have very well written, documented evidence that even from the pre-Vedic age itself, Ayurveda and Siddhas, this classical, our Bharatiya traditional health systems have contributed many things to the healthcare and especially to the eye health. And even in Ayurveda, it has been mentioned that Sarva Indriyanam Nayanam Pradhanam. In all the sense organs, the eye is the most important thing, should be taken care. And also, especially our Acharya Vagbhada have mentioned those who are not taking care of the eye, and if he goes without vision, then he will be like an insect which has no, nothing specific objective to do. Like that will be the life of the person. So eye care should be done to an individual in a Dinacharya routine itself. Ayurveda has specially mentioned. For example, in the Ashtanga Hridaya classical text, you might have heard about the Ashtanga Hridaya text. In that it has been mentioned that in Dinacharya Adhyaya, the procedures which should be one person should daily do to preserve the overall health of the individual. In that, some procedures, some things have been mentioned, especially for eye, like that Anjana Karma and Nasya Karma. Anjana Karma is just like collyrium applying over the eyes, and the Nasya Karma, installation of medicated drops over the nose, and especially Shiro Abhyanga. Then snana, how the bath should be taken, that will help in the enhancing of eye health. How the pada abhyanga should be done, how the feet massage should be done, how slippers should be wear, how a umbrella should be used to preserve the health of the eye. So eye health has been, the concept of eye health has been well written, documented in our classical texts since long. As doctor have also conveyed in Ayurveda itself also, Susruta Acharya, you may have heard about him. He is the father of our surgery. The first written document of cataract surgery is done by Susruta Acharya, and the cataract that had been mentioned as a special chapter itself is there for that. Linganasha Pradisheda Adhyaya has been mentioned in our classicals, whether how we can treat the cataract, how the surgery should be done. And nowadays also, in the present era also, Ayurveda has contributing many things to the eye health. You might have been heard about the recent incident of the Prime Minister's Dr. Kenya Prime Minister's Dr. Rosemary's eye health was being cured in Kerala. She was blind, she came to Kerala, she done the basic Ayurveda treatment, and she got cured. The former Prime Minister of Kenya's Dr. Rosemary Odinga. So there are even the written historical evidence and the recent documents also shows that Ayurveda and our traditional health systems can contribute much towards the eye health.
Okay. Doctor, can you suggest me some tips for general eye health?
As in Siddha system, we should follow a preventive aspect, like we should follow the regimens Nasyam, Anjanam. These have to be followed in a regular basis. So it can normalize the deranged Vata, Pitta and Kapha in our body. And along with that, we have internal as well as external medicines. Externally, we have Tarpana treatment, that is external oilation, and Otrodan treatment, Anjanam application, Kalikam. Kalikam means it is a eye drop pattern. And other than that, we should have internal medicines. That is, internally we can provide Karisalini. It is the best option. And the main medicine that we are seeing is Ilanir Korambu. It is commonly non-medicine. And as an eye drop, we suggest another medicine, that is Padigara Neer. That is given as an external wash to prevent other irritations in the eyes. And other than that, we can give ghee-based medicine to cool the body conditions. Okay. and Ponnanganni, it is the best option. And other pack, eye external
eye
pack
packs,
can be provided. These are also mentioned in our Siddha text.
Okay. What about some Ayurvedic medications for eye health?
Yeah, as Dr. Sreelakshmi have conveyed, the preventive aspects also have a greater importance. Now, the recent documents and recent evidences shows that the Western world is going for the P4 medicine, the predictive, preventive, and promotive and participatory type of medicines, which was our Bharatiya culture of treating the diseases. Because we are not treating the diseases when it has manifested.
Yeah.
The preventive concepts was high. So the preventive concepts, including, as doctor told, the basic preventive measures that especially the eye health, including the Dinacharya things that which I have mentioned earlier should be done. And the disease perspective, around 76 diseases has been mentioned by Acharya Susruta, and Vagbada have mentioned about 94 diseases. In that, many diseases which are even the names of the Ayurveda diseases which I have mentioned as Sanskrit terms, many have the recent, what to say, many diseases are even more relevant to the up-to-date conditions. Nowadays we have in the digital era, our screen time is increasing drastically. An average around 5 to 6 hours youth is been into the phones, and because of that our blinking rate is reduced, because of that dryness is increasing, and that's why computer vision syndrome is been increasing. There Ayurveda can contribute much. For example, doctor have told about the ghee medicines, the Ayurveda, especially the medicines such as Triphala Grida, Jivantyada Grida, and these medicines have given drastic results to treat this dry eye syndromes and all. And the refractive errors, I think much thing which can do with instant results is refractive errors in Ayurveda, with our basic procedures like Tarpana, Karma, the Seka, Ashodhanam, and all have better results along with the internal medicines that, as doctor told, Abhyantara Chikilsa and Bahya Chikilsa. Bahya Chikilsa, we have that external therapies, we have the Kriya Kalpa procedure itself. In that Kriya Kalpa procedure, the Seka means installation of drops like in a dhara and over the eye. Then Aschodhana, installation of medicated drops in the eye. Then we have Anjana, over the medicated creams and medicated paste we will apply over the lid margins. And then we have Tarpana, putting the ghee externally through making the ghee hold over the eye for a period of time. Then we have Shirodhara. Like that, many different procedures we have there. That's which have given better results nowadays. Recently, I had a case in which the refractive error, the patient was having 6/60 vision. With just 7 days of treatment in our Santhigiri Ayurveda Medical College in Palakkad, with the 7 days itself, the patient was able to have the vision by 6/6.
Oh,
So
okay.
we have also having better results, and we are also getting better improvement in many conditions.
Make your eye care a priority so that you can see the world with clarity and confidence.